All right, we will go ahead and get started. Hello, everyone. My name is Renata Ndahayo. I am a Gepin student here at Yale. I am currently doing the family nurse practitioner specialty, and I'm really excited to welcome everyone at the first Yale School of Nursing Black History Month event. We'll be doing a talk with Constance Evans, along with Caprice Brown. So a few ground rules before we get started. We ask that all microphones are disabled and stay muted for the entirety of the talk. Should you have any questions, please write them in the chat and I will read them to the speaker to answer. We ask that you respect these rules to prevent any interruptions and ensure a seamless presentation. And now for the bios of our speakers today. So Constance Evans, after 26 years of active duty service, Constance Evans retired from the United States Navy as a full bird captain in the Nurse Corps, completing tours across 3 countries. Her duty stations include being a regional clinic manager for over 12 clinics throughout Navy Region Southeast, being the senior nurse educator for more than 890 newly recruited corpsmen, and serving as the Wounded Warrior Care Coordinator at Walter Reed Medical Center. Upon retiring from the Navy, she returned to her hometown in Jackson, Mississippi, where she worked at WellCare, which is an insurance company that worked alongside federally qualified health centers, otherwise known as FQHC. Caprice Brown, RN, BSN, has been a registered nurse for 29 years. She has served in various capacities of nursing. She has experience in critical care, burn ICU, med surgical, case management, utilization review, transitional care management, dialysis, and quality. She has been faithfully serving the Memphis area in providing compassionate care and advocating for patient rights. She is compassionate. She is a compassionate patient educator, and she enjoys educating patients on disease management and prevention of disease progression. She's a proud graduate of the University of Memphis Lowenberg School of Nursing, and after completing several years of nursing, she embarked her journey to complete a Master's of Divinity in May 2019. Caprice is currently the Manager of Quality Improvement at WellCare Health Plans, and her mission is to improve the quality of care of one member at a time. She is an innovative strategist in creating ways to improve and provide the best care for each member. So without further ado, I give you Constance Evans and Caprice Brown.
Are you able to see my screen?
Yes.
Yes. Yay, good start. First of all, thank you for that wonderful introduction. So I'm ready to sign up you in the Navy, recruit her to come in and work alongside of the nurses in the Navy. So thank you. And I want to give a shout out to Caprice. Haven't seen her in years and she's still working with the Federal Qualified Health Center. So I am a retired Navy nurse, as you heard before. I have a master's in healthcare administration. So why am I before you today? And let me tell you, it's an honor and a privilege to be before you. And I thank you for very humble, and thank you for the invite. So let's kind of talk about me, who I am, 26 years, 9 duty station, a variety of assignments, right? So the good part about the military, and we can have a conversation about military healthcare nursing, different conversation, right? Different meeting. But med-surg, you start off in med-surg and you move your way throughout a variety of assignments. And typically every time you move, you have a different assignment. So that's why you see I have a variety of assignments. And because I was administrative, not clinical, as you can see, I moved from Pensacola, where I started in San Diego as a med surg, moved into quality in Pensacola. They assigned me at one clinic, and for some reason they thought I did a wonderful job at that one clinic and moved me as the OIC to several clinics. And so that was a eye-opener. And then after transferring to course school and working in Spain, the best duty station, we ended up in Chicago course school, and then Walter Reed, Maryland was the final tour. And I show you a picture because teamwork, that was the team that actually worked with me. That's me right here, worked with me to move the Wounded Warriors. It took a team, it wasn't just me, and we'll talk about the importance of teamwork. 2013, I retired, and for some reason, the VA thought they wanted to hire me, and I went over there, and they did hire me. And I lasted about a year in the VA. That was an eye-opener. Moved home, took care of my parents for about 3 years, and worked at WellCare while I was home taking care of my parents. And that's where I actually met Caprice, and we worked with the Federal Qualified Health Centers. I grew up in the military health system, and I think in your journey as a nurse practitioner, what you have to learn is that there are different healthcare systems there, right? Healthcare systems. And so this is what we're talking about, the Federal Qualified Healthcare System and what that means, okay? My current position where I work is with Safe and Reliable. If you do any study with safety, you'll hear of my boss, Michael. Michael is Michael Leonard. He's like one of the fathers in the patient safety, and Alan, he's the other father of patient safety. So if you ever want to do some study in patient safety, more than happy to talk about safe and reliable work, okay? So let's move to why we're here, right? Federal Qualified Health Centers. What's important? Why are we having this conversation? I tell you, one of the things, apply for the scholarship, but when you apply, realize that there's a tail with that application, right? The expectation. What does this mean? I get accepted, I get the application, I apply, and they say, thank you for coming. What does that impact to you as a nurse practitioner? You're going to be working in a community health center, most likely in some of the rural areas of the United States. They're called federally qualified when they're federally funded, okay? They have some community centers that are not federal funded. When you're talking about federal qualified health center, that means that they're getting funded by the government, the federal government. Why do they exist? They're there to serve the community. They're there to serve the most vulnerable population. And we'll talk about the population that they serve. And predominantly they're there because we want to decrease, right? Decrease that emergency department utilization, that cost. That's a big cost. That's a big bill. And when people can't pay that bill, guess who pays it? You, me, the private citizens, right? And the care coordination of those citizens decrease, those patients decrease because now they've gone into ER, they don't have a doctor and the follow-up opportunities, okay? So that's really important to understand why we have those federal qualified health centers. All of the federal centers are governed by a board of directors. In Mississippi, they had the primary care board of directors. It took us a little bit, and Caprice could verify this, to understand that board and how they operate in the function of that board. But once we learned, and we started networking with that board of directors. When you have oversight of these clinics, when you go in there to work, you want to understand how do they operate, because that's vitally important. The funding, how do they get funded? What's your impact to that role of funding, and how do they operate, okay? Additionally, what's important, you want to understand that population, right? Who am I serving? What's my patient? Understand that patient population. Everyone's welcome. You're welcome to go to the Federal Qualified Health Center. I'm welcome to go. They do not close the doors to anyone, okay? They're there to serve the community. But the population that they serve predominantly are low income, uninsured, and underinsured, okay? And when patients go in there, you pay on a sliding scale. And that's important. That's really important to understand the population that you're serving, okay? So let's talk about the funding, and Caprice is going to go in a little bit more about the details of the funding. Your scholarship comes from HRSA, right? HRSA funds all the federal qualified health centers, and that's under the Health and Human Service agent of the federal government, okay? In order to qualify to be a federal qualified health service, you gotta read up on that section 330, because that's the funding to meet the qualification to be. So you can apply, you can open up your own federal qualified health center. You're a physician, a nurse, practitioner. They can say, hey, I meet the qualifications, and ask for federal funding for that particular site. We have plenty of doctors in Mississippi that they have a small practice and they apply for federal funds and consider themselves as a federal qualified health center. So funding is important. When you talk about the care, remember, you're dealing with the population. You as a practitioner, you're dealing with the population that your reimbursement is from Medicare and Medicaid. A lot of news and information on Medicare and Medicaid. So you want to remember that when I'm working in a federal qualified health center, I need to meet the standards of Medicare and Medicaid. That's what's important from this slide. And additionally, what's important on this slide, how do I meet those standards? What do I do as a practitioner to meet those standards? If you don't take anything away from today's conversation, here's what I would like for you to gain. I apply for this scholarship, I'm accepted, I owe time back in the federal qualified center. What do I do as a practitioner? I do preventive health services, I refer to dental services, I make sure that the patient has their mental health and substance abuse services. I coordinate with transportation, I help that. Now you may have a team to do that, but you as the nurse practitioner, you will have oversight. You would be that team leader. The services that you provide, preventive health, dental, mental health, transportation, specialty care, it's the most challenging services that you can provide in that setting. Very challenging. And I'll talk about on the next slide, some of the challenges that I faced when I was in there. And what surprised me coming from the military healthcare system, right, is that preventive care, number one, you are chased down to go get your preventive care, number one, okay? And in a federal qualified health center, we on the insurance side had to chase the providers to say, you need to get these patients in to get their preventive care. And we had to call patients to encourage those patients to get in. You see the difference in the type of healthcare system, right? One system, you're chased down as the patient. You need to go in and get your screening. It's expected every year. Here's what you need, your dental. You're placed on the list. You need to go get your ears checked. You need to go get your everything checked every year. In this healthcare system, we in the insurance company started to chase the patients down to say, you need to go get your preventive care. So that is what I want you to take back as a nurse practitioner. You have to really encourage your patients. You need to get annual preventive care, that dental services, that mental health, screening, whatever services they need. You have got to take that role on. So important in this setting. So I want to talk about, and if you have any questions, and I'm sure that slide probably, well, what about funding? Talk about coding. So we'll talk a little bit more once Caprice gives her presentation. So let me talk about reliable care. You hear a lot about harm in healthcare, okay? And it's real. And so I'm not gonna shade and say we don't do harm. We do harm to our patients. And how do we do harm to our patients? If you look at the airline industry, if you look at the nuclear medicine industry, if you look at those two industries, they get it right every time. Reliable care every time. You get on an airplane, you know you're going to get from point A to point B. And when they don't get to point A to point B, they shut that airplane industry down, right? In healthcare, when we have, the number of unfortunately deaths we have right now for COVID, we don't shut healthcare down. We don't stop and say pause. So how can you make sure you provide reliable care in the federal healthcare, in the federal qualified health centers? What can you do? Let me talk about teamwork. So important, so important. And let me give you a few examples of teamwork. When I would work in Mississippi in that federal qualified health center, and I would work with the doctors, physicians, and it was a team approach, these were probably our 4- and 5-star CMS Medicare facilities. They were highly quality, their quality of care was just fantastic. You can go in, talk to the physician, talk to the nurse practitioner, talk to the nurse, talk to about preventive care, what are the services they need. It was a welcome conversation. When you work in there, drive that communication, that teamwork. Pull your staff together, look at your patient list, look at those patients coming in, have that communication, that conversation. So important to have that teamwork, collaboration, and not only internal, but you may have to work as a team with family members. You may have to say, this person is not compliant, we need to get a family member, we need help with making sure that they get their care that they need in that setting. So teamwork. Communication, vital. Internal communication, external. What do I mean by internal? Psychological safety. Great book, Amy Edmondson, research from Harvard, kind of the mother of psychological safety. Go read about it. Just Google, right? Google did a lot of work with psychological safety. When you have, as a nurse practitioner, you say, I want to hear the voice of the tech, I want to hear the voice of the patient. The voice of the patient, so important. I want to understand what are the barriers to care. I want to understand their educational level. If they're unable to read, then I want to be able to make sure I can supply the information at their level. I want to meet that patient where they are. So important. Go and read in between your time more on the work that Amy Edmondson has done in psych safety, as well as the studies that Google has done, teamwork, communication. Underserved population, rural areas. I drove around 30 miles, I don't know, just long drives there and back, going to some of the most rural areas of Mississippi to make sure that patients were coming in for their care. And if they could pick up their medicine, or what could we do, right? So WellCare, hey, how can you help with transportation costs? Can we give them bus pass? Can we give them taxi pass? How can we get these patients to their appointments? And so I drove miles to make sure in some of the rural parts of Mississippi to help patients come in for their care. I would sit in some of the office spaces of our clients to say, can I call these patients here and let's see if we can get them in. And if they were already scheduled appointment, I would try to work with the providers, you guys, to say, hey, here are the services that these patients need, okay? Education level. And, we have a lot of patients in Mississippi, 3rd grade education level, okay? So you can't go in there and say diabetic care. They're gonna look at you and say, what is that? You can't go in there and say, I'm gonna send you to a podiatrist. They're gonna say, what are you talking about? 3rd grade education level, okay? It's true, it's real. You can go in there and say, your sugar is elevated. Oh, okay, my sugar is elevated. You can go in there and say, we need to look at your feet because we're concerned about the circulation, the blood flow. Oh, okay, so I need to send you to a doctor that takes care of your feet. Don't go in there and say podiatrist, because they're gonna say, I don't know what that is, and I'm not going, okay? When even my family, who still lives in Mississippi, right? When we do not allow my father to go to the doctor by himself because of that communication, education level, okay? So I would tell you as nurse practitioner, be mindful of the education level wherever you are, because we wanna say medical terms, and as my daughter reminds me all the time, Mom, you're so nursey, you say these medical terms, and so I have to come back and relay that, and you will also. Also, medication. You take medication for granted. Oh, we prescribed you some medicine, it's at CVS, you need to go pick it up. We had so many patients to tell us, I can't afford to pick up that medicine, and I don't know what it is because the doctor didn't explain it to me. Education level. Huge problem in rural Mississippi, transportation. Huge problem. Be careful when you work in the federal qualified. Do they have transportation to specialty care? Very much a problem there. And work and coordinate, right? It goes back to that teamwork and the conversation with your patients, right? Culture barriers. So if I'm coming in from, and even me, born and raised in Mississippi, I spent 20 something years in the military. When I go back to Mississippi, where are you from? Because you don't sound like us, right? It's real, culture barriers. So you have got to put yourself and make sure when you talk to your patients and when you speak to your patients, you understand that culture of where, you know, you're not from the South, you don't sound like us. Where are you? So that culture, or understand the family dynamics, or understand the housing. So just a lot of culture barriers. Put yourself, ask the questions, come down to understand in that population, the very rural of the United States, really have to understand the culture barriers that they have. And one of the words I didn't put on the slide, but should have with the trust, respect. One of the things in healthcare that we really push in order to build trust with your patient, to build trust with that staff, and this is mainly outpatient care that we're talking about with the federal qualified health centers, respect, right? I have got to respect my patient. I have got to respect my staff. I still work as a consultant with Walter Reed. And one of the things that we tell our clients in any healthcare system, respect for each other, trust. If you look at high reliable care, if you go into those organizations, we are very good technical. I'm going to tell you, there are some really smart nurses and doctors in Yale, and I guarantee you have some of the smartest people there. But when we come to respect and trust, we sometimes fall behind the line there. So I'm going to end on my slide with family-centered care, respect, dignity, collaboration, flexibility, information sharing. This is what we like to see you as the new nurses coming in into the healthcare setting. I'm a retiree. It's time for me to go and get enjoy the time at the beach. You guys are coming in, and this is what you can do, right? Here's what you can drive in working with the federally qualified health centers. You can walk in and say, preventive care is number one, and we're going to do it. We can respect and have dignity for our patients. And the patient's at the center of the care, right? So that slide is where we'll like to see all of medicine, not just federal qualified, but all of medicine, where patient and family are at the center of the care. So I thank you. I hope that helped in understanding. I'm going to stop sharing and allow Caprice.
Good evening. I think it's evening where you all are. I am delighted to share information with you all about the federally qualified health centers. I count it an honor to share this information with you. So many points that we could elaborate on, and I'm just going to hit a few highlighted points. One is preventative care. Preventative care is the best care. In the federally qualified health centers, you'll find oftentimes that based on the area, most of the time, as Connie mentioned, that is the underserved population. So most of them are not necessarily familiar with preventative care. They seek care when something is wrong. So if it's not broken, why fix it? So you have to deal with some of the mindsets of those patients, because that's just how that's just the culture. That's how they were taught and they're not used to seeking care when there's nothing wrong. So you have to do a lot of education with them to know the importance and stress the importance of why we do this before it happens, because we can sometimes even prevent it from happening. So education is very important. And as Connie touched on before, you have to meet them at their level. You can't always go in with all the medical terms because they'll just sit there and nod their head, and they really didn't understand a word you were saying. It was as if you were speaking Greek to them. So make sure you're aware of the those aspects. But preventative care is the best care, and you have to really instill that in the patient. The Welcome to Medicare exam. This is something that is provided by CMS when they first come on to Medicare. There is a welcome, it's a once-in-a-lifetime exam. There's a Welcome to Medicare exam. You can go out on the CMS website, and they'll have all the information about it. And it's a good tool to use to get them in the frame of doing all of these preventative things if they have not already been doing them. Completion of the annual wellness visit, that's just a part of the care. A lot of providers only do checkups. So you come back in because you have diabetes. You come back in because you have high blood pressure. So it's just a checkup, but never go through the head-to-toe assessment for a preventative exam. If they complete the preventative exam, we can prevent the progression of several of the diseases. So when you get them in the mindset of preventative exam, then they will. Now, I've heard all kinds of stories. In 29 years, I could write books of why they don't want to do it. They don't want to do the mammogram because it squeezed their breast to death. They don't want to do the colonoscopy because they don't want to do the colon prep. And so you have to be mindful of those things, but also offset that with the benefit of it. Because 9 times out of 10, they've had somebody at church or in their community that has encountered breast cancer, colon cancer, and that was their demise. So you use the information that you have to meet them at their level to gain better understanding and communication, as well as they have to trust you to know that you're giving them the best information. So I've already touched on education is critical, making sure they're aware of what you're asking them to do and why. Proper documentation. You will encounter every guideline known to healthcare. CMS guidelines, you have NCQA standards, you have the HRSA regulations, and that's critical in the FQHCs. Familiarity with proper coding and HCC recapture. Knowing the CMS guidelines is critical because if you're not documenting properly, that's revenue that's not going to come into that center. The better you document, the more thorough the documentation is, then the better information you have about that member. And you have to think about, you're not the only one that will take care of that person. So the next person behind, if any of you did shift, the next person behind you had to know what happened during your shift. So if the next person, practitioner, physician, whomever, comes behind you to see Mrs. Jones, you have to be able to provide adequate documentation so that they don't miss anything based on something that was accidentally left off. You know it. The patient can't always articulate it, so it's good to have that adequate, proper documentation. The NCQA standards, if you haven't heard of HEDIS, you will. HEDIS is one of those NCQA standards where it's involved in quality, and every year the health plans will ask for charts to validate documentation. Throughout the year, they're asking you, bring the member in to make sure they get these services and these procedures completed, because it's all leading into that quality care and those care standards. The HRSA regulations, the FQHCs go through those HRSA regulations, I think it's every 3 years, where they have to meet the standards. Some of the standards are, they all, out of CMS, NCQA, and HRSA, they all overlap in some degree. One will have a little variation from the other, but they all overlap, and they're all looking for standard guidelines, quality standard guidelines. Familiarity with the coding. When they went from ICD-9 to ICD-10, it was for better specificity. So you could better document what you have encountered and what you are diagnosing that patient with. So knowing the proper CPT codes, HCPCS codes, and the CPT-2 codes are the ones that the insurance companies look for. That's the documentation that is not necessarily revenue generating on a claim, but it provides all of that information for those standards that CMS is looking for, as well as NCQA is looking for. And the HCC recapture, based on CMS guidelines, CMS says basically that a patient 12/31 at 11:59 becomes healed miraculously. So whatever diagnosis they had all year long, when 1/1 rolled back in, that patient has no diagnosis in CMS guidelines. So you have to provide all of that documentation all over again. So each year you have to make sure you're pulling up their historical diagnosis as well as whatever is current with their diagnosis, because based on the CMS guidelines, they're healed at the end of the year every year. So that HCC recapture is very important in making sure you document properly. Quality and outreach programs. Patient outreach is a critical aspect of the care in the outpatient setting. These patients normally do not have a lot of resources, so you have to put things in place in order for them to be able to maintain basic standards. So having a good outreach program, outreaching members. There were numerous times when I did transitional care management. These were patients that were transitioning from hospital to home. So many of them didn't have anybody at home to care for them, nobody to go pick up their prescriptions when they left the hospital, and nobody to even, set food up, take care of them, just even check on them to make sure they were okay. So when you have those outreach programs are lifelines. One, it shows that somebody cares about them. And they oftentimes will keep you on the phone longer than you really anticipated being on the phone with them, but it's a lifeline to them. And once they get out of the rut of nobody cares, they begin to pick themselves up, basically, and begin to do those things that are critical for their longevity. So having that good outreach program, the referral process must be connected to the outreach program. So you have a critical position in being able to make sure that those are blended. when you have a blended program with outreach and referrals, patients don't fall through the cracks. Oftentimes, you'll write a referral. Okay, I want this member to go and be evaluated by the endocrinologist. Their blood sugars are out of control. You know, I've tried a couple of things and nothing seems to be getting better. So you do that referral. Well, nobody checked to see if the member had transportation. Nobody checked to see if the member understood, you know, why am I going to this doctor? I just saw you, so what do I need to go to another one for? You have to really be thorough in your explanation, very plain, very simple, as to the importance of making that appointment and making sure you've identified the barriers that they may come up against in order to get there. It's a lot of extra steps, if you will, but it pays off greatly in the end. But making sure they understand and those two are connected, because if you wrote the referral, nobody ever called to secure the appointment, transportation wasn't arranged, and you wonder why Mrs. Jones never came back in. Well, Mrs. Jones showed up in the emergency room in DKA and from there passed away. So you try to prevent those things. Some things can be prevented. Some things are just totally out of our control. But those things, you can begin to put things in place to make sure it's not a crack and it's definitely not a crater that the patient falls through. Participation in quality programs are essential. Making sure that when they're asking, okay, did they complete their mammogram, that you've documented. Even if they said, no, I refuse, but you documented that you offered this service and that they refused this service. And you can't just do it on a liability standpoint. You can't just do it once, you know. Next time they're in, okay, I see you didn't get your mammogram. Are you willing to go ahead and do that now? You know, the mobile van will be in your area, you know, whatever, so that you have the documentation that supports you've offered it on numerous occasions, but they just continue to refuse. The payment for performance program. Most of the commercial insurance companies, Medicaid companies, as well as Medicare Advantage plans offer, and CMS now even offers a payment for performance. Based on your documentation and those members completing those services, they pay you basically money for you ordering those services and getting those services completed for those members. So that's money on top of your revenue that's generated from the office visits. That's additional money that comes into those clinics to be able to provide additional support and monies to do other programs that will help the members as well as that community. Consumer assessment and healthcare providers and systems. This is a survey that comes out every year based on how well is the member's perception of how well you took care of them. In the hospital, you had JCO. Now, in the outpatient setting, there's this called CAPT. They call it CAPT, where the members are surveyed once a year to see how well you're taking care of them. And it's just straight from their specific questions, and it's straight from the guidelines, and they just answer. Now, a lot of times, especially it's one about, did you get the flu shot? Well, they didn't get the flu shot because they didn't take the flu shot. They refused it. But that's the way the question is worded. So that's the answer they present, and that's not always favorable. Health outcomes. How well are the members remaining healthy and staying healthy? That's another aspect. The cultural aspect. Knowing the culture of that area and the various cultures of whatever area you're going to be in is key. because I remember when I was viewing properties, the real estate agent said, oh, this house has a door that faces the stairwell that faces the door. Certain cultures will not like that. So knowing those things, that just says she wouldn't show that house to certain cultures. So knowing that information is key in being able to help the patient to get through barriers. Some, based on whatever their religious beliefs are, will not do certain things. Knowing that, you have to already know an alternative treatment modality to offer them if it's available. Knowing the cultures, as I said before, I could write books on when a patient came in and blood pressure was at stroke level, and they told me, oh, I'll just wipe some alcohol across my head and drink some pickle juice. And I'm saying to myself, and you're gonna stroke any minute now. So it's those things, though, that they believe in those things, and we have to help them to understand the treatment modalities that we're attempting to offer and why. When we can identify those barriers early on, that is so much better, because then you're wondering, the patient is not labeled as, a lot of times they're labeled as non-compliant. It's not necessarily that they're non-compliant, but they don't understand what you're asking, or it goes against one of their beliefs. Making sure you have that team effort, the social worker, the community health worker, and utilize your community resources. Most of the time, the FQHCs are connected to so many community resources that it's always enough information as well as resources for women that may come in homeless, women with children that are, being abused, domestic violence. They have all of those resources, and you just have to tap into those resources to learn what is the referral process, how quickly does it happen, what do I need to do to make sure that I'm doing the best thing for my patient, total health. And I thank you for your time, and that's all I have.
Thank you so much. First, I want to tell my roommate who's upstairs that her mic is so first I want to tell Captain Evans and Nurse Brown, thank you so much for taking time out of your schedules to talk to us today. You guys are the nurses on the front lines. You guys are the ones who have been taking care of some of the most vulnerable populations that this country has. Right now we are protected by the stone walls in this ivory tower that is known as Yale. But in 18 months, the Gepin class will be taking your places. And we will be on the front lines, hopefully taking care of some of the most vulnerable populations that the U.S. has to offer. And we'll be looking to you guys for your leadership. So please see it as no small task that you have taken time to train us and educate us, because we have, I have been told that we are one of the leading schools that get these NHSC and nurse corps scholarships. So we will be out there. We will be using this information, and we will be in a position to either do a world of good or a world of others. Hopefully, because you guys have talked, we are more equipped and more prepared to do a world of good. So I do have a couple questions that I want to ask. Please feel free to jump in and answer as you see fit. The first question is, when you get these scholarships, you have to choose from an available FQHC site. So you might move to a community that is not your original community. How do you learn, Captain Evans, you talked about learning about your patients, learning what their values are so that you minimize harm. How do you suggest, if I'm moving to a new community, learning about the people that I will be serving and their values?
Well, I think Caprice hit on that also, is that when you get your assignment and you in a new community, and I can speak from military, I will always integrate myself into that community. So I had to learn, where's the local church? Because in your federal qualified health centers, and you're going to find a lot of times you want to know your church, you want to know your barbershops, you want to know about your grocery stores, you want to know how the people interact in that community, right? As well as you want to sit down with that staff and say, talk to me about our patients. Let me learn what type of patients we have coming in. What are the high risk issues? Before you even touch a patient, see a patient, learn about that community. So you want to spend just a couple of days, just 2 or 3 days, maybe even a week, just learning, driving around, seeing the community, seeing how they live, talking to your staff. Because once you start seeing patients, your staff, they don't care about you just graduated from Yale. They're going to say, oh, good. They want to know, what are you going to do on the floor to help us to take care of these patients? Every 9 duty stations that I went to, okay, thank you for coming here, but let's get to work, right? So take some time to learn and understand your patients, understand the community, drive in the community, understand the grocery store is 20 miles away from some places that may not be a grocery store, maybe a little bitty store. Understand, transportation is a problem to the nearest hospital. So now you kind of have a picture of how that community operates. And I ask Caprice if she has any words of wisdom, but I would tell you to spend a few days just learning the community before you ever touch a patient, because that's going to set you up for success to understand the population, that community that you're working in.
Similar question, Caprice, but in a different way. You've been working at Jackson Hines. Is that the? Oh, you're on mute.
Okay, I was double muted. My apologies. I'm in Tennessee, so we have like 40 FQHCs here in Tennessee. So I've worked with those here.
Okay. What would you say is the biggest pitfall that you see new nurses make? What advice would you give to us who are about to graduate?
The main thing would be, like I said, making sure the cracks are sealed. When you're making those orders, writing those orders, make sure it's carried out. Do the follow-up to make sure, you'll be seeing a lot of members, patients a day, but make sure you got some kind of little tracking system to be able to do your follow-up to make sure when one of them don't come in that you are concerned about, that there's some outreach, they're entered into some outreach program. There's one thing that's called chronic care management, because a lot of those patients will have chronic conditions that they need to be entered into that chronic care management program, so that you're checking on them, making sure they're getting their medications and making sure they're getting, they're taking care of themselves properly. For most of us, just going to the grocery store, picking up the items that we need is not a challenge, but for them, it's a challenge, and it's also a financial burden sometimes.
Great.
This question came from Dr. Reynolds here at Yale. I don't know why I'm speaking. I apologize about that. I'll make it quick. Could you talk at all about listeners? and if they're funded by HRSA, and if they are also open to students as FQHCs.
Which one's that? Actually, repeat the first part of it.
Migrant health centers.
Migrant health centers. So I know HRSA funds FQHCs in the Indian reservations. They are funded by HRSA, but I'm not sure of that. I can't answer that one. So I do know the Indian reservations because they are considered part of the rural care. So they do send nurse practitioners and doctors there, but I'm not familiar with that one. That's a great question. So whoever answered that question, that's a great question.
And then I think Heather Reynolds wanted to, you can say something now.
Hi, thank you so much for that great presentation.
Well, thank you.
Really appreciate it. I worked when I left Yale in 1980, I went to Florida, rural Florida, to work in migrant health care system. And it was one of the loan repayment, not the National Health Service Corps. But it was gotten through HRSA, though I think that the government organization now that's responsible for that there are about 800,000 or more migrant workers. And that is a viable option for loan repayment and for, we had a number of National Health Service Corps scholars who came to work in the various clinics, and we had 5 rural clinics, and it's an extraordinary experience, and particularly working in South Florida, being trained in the Northeast, you're not apt to encounter tick-borne or a lot of other diseases that are more tropical. And so wherever you go, you will need to really get familiar with what some of the issues are. For the farm workers, it was pesticide exposure, et cetera. So you've got to get well-versed in the issues that impact those communities so that you can continue to learn and develop skills to really address the health concerns of those specific communities. But it's also an option for you.
Yeah, that's a really good point. And I imagine some of the migrant workers, so in the federal qualified health centers, they actually integrate some of those workers into that system, into the federal qualified system also. You'll see that they receive healthcare in some of those systems. So that's really good information. And I think a key point you brought attention to is that you have to understand the illnesses, right? The disease that are with the particular population when you move into that community. So that's really key to the question of understanding your community. What are the disease that you're seeing in that community? That's very good. Great question.
Olivia Dumont asked a question. She is a nurse midwife option. Is that right, Olivia? Perfect. GEPIN student graduating in 2023. Caprice's question is for you. She asked, for the man who had a pending stroke and he wanted to self-treat with, like pickle juice, how do you demonstrate respect for his position, but also make sure that you take care of your patient and give him the care he needs?
You acknowledge the treatment modality because that's what they used, but now you acknowledge, okay, but we have something else that you can do or take, or some diet modification. You have to let them know, they'll say, I rinse this off, and so that rinsed off the salt. But then you got to say, okay, that rinsed off a pinch of the salt, but that didn't get rid of all the salt because it's just packed in salt. And so, you get them in the mindset of look at your boxes, look at the can label, so that they understand salt is in everything. So you have to have that reduced salt, but you acknowledge where they are and then you offer, okay, would you just try this? I'm going to give you a sample if you can. You know, would you just try these for 5 days, 10 days, and come back and tell me, how did this work? Did it make you feel bad? Did it make you feel good? Did you feel better? You know, you have to build that trust in that relationship with them.
We actually just got another question. Thank you for that answer. We all make mistakes, especially us, you know, coming up as new nurses. If we are in a new community and we accidentally offend a patient, how do we go about repairing that relationship that could potentially already be so fragile, since there could be mistrust in the healthcare system?
That's a great question.
Apologize. Apologize. It's all in trust, you know, and that willingness to humble down, to say, okay, we got off on a bad foot. You know, what can I do to mend this? I really want to be in your corner and be a support to you. You know, so it's allowing them to sort of drive, but not drive.
Right.
You know, it's a mutual relationship that you're building. And so when you do that, they will end up being your best friend, you know, just because you put that trust there with them, and to stand up and say, you know, that now, of course, everybody's not going to do that, but if you have to do that to start it out at least.
Right. That's absolutely, and that's a great question. And again, respect, trust, right? So I can tell you that in medicine, you know, in my years in medicine, you've had people to make mistakes. It happens, right? Unfortunately, it does happen. And when you say and humble yourself down and say, I'm sorry, I honestly, you know, please accept my, you know, please forgive me. You know, when you have a humble heart in medicine, that's when that patient will trust you. And research shows that when you go back and read the literature on when there's been harm committed to patients, and the physicians and the nurses that go back to that patient, to that family, and say, I'm sorry, and admit I committed, you know, what happened, they trust that doctor, that nurse. It's plenty of literature out there on when we do harm, and that's the world we work in now, right? Caprice is working to make sure that we don't do harm by ensuring that the patients get their preventive care. I work in the world where we get it right every time. We look at the processes, we drive out defect, and so we become that airline industry, and we become that aviation or the nuclear industry. So now we're getting it right every time we see a patient. So it definitely, I'm sorry, goes a long way.
So we have time for one more question. This question comes from Ruka Adamola. She was wondering if you had any words of advice for how do we prepare for working in a FQHC when we're new nurses. So you talked about, you know, staff shortages, limited supplies, going the extra mile since you're taking into account transportation, you're following up with patients, you're doing that as a practitioner because you may not have the staff to do it. How do we prepare for something like that?
I would tell you everything is about learning. So when you walk out of Yale, you're not going to stop learning. So your curve to prepare for that center is that you're going to read about everything about that center. You're going to read about that community. You're going to know the type of patients that they see. Am I going to Indian population? Am I going to Mississippi? And I can't tell you some of the towns in Mississippi that I drove to. You're going to read about those places, okay? So everything that's about learning, your learning doesn't stop at Yale. You're going to go before your assignment, you go into that and introduce yourself. Hey, I'm Constance Evans. I'm coming here in a couple of months. You know, I'm preparing. I'm transitioning out of Yale from school. I just wanted to meet the staff. I wanted to drive around, see the community. You're learning, all right? So your preparation is that I continue to learn once I get out of Yale. And then I go and research that community, the population that I'm going to serve. I go and meet the people, the providers, the staff. I drive around the town. Everything is about learning. You don't stop learning once you leave Yale.
So I think that is all the time we have today. I don't know why I'm screeching like that. Sorry, y'all. Thank you so much again for joining us. This is one of a myriad of events that we'll be having on behalf of Black History Month. Please join us for our next public event, which will be on the 15th with Nasima McElroy about how to become a millionaire while nursing. And then we will have one final public event regarding paying off massive amounts of student loan debt. I want to take this opportunity to once again say thank you so much to Caprice Brown and Constance Evans for joining us on a Tuesday night. It is no small favor to us when we have, you know, people on the front lines actually doing the work that we want to do. We are talking the talk, you guys are walking the walk, and that is so very important for us to see as nurses. So thank you so much for joining us tonight. Thank you everyone for attending, and I hope to see you on the 15th.